First, the people. Unbelievable talent base with an unbelievable passion. More passion than I had seen in any other nonprofit, more passion than I had seen in some of these big, large names that people aspire to both work for, work at, be served by. The center set sort of a new standard in my mind as to what a nonprofit could achieve in terms of passion and talent. Second, the center was unwavering in terms of what it did. Now, the center does a lot, but the center is always focused. Every decision is about the client. It's about the person who walks in who's seeking care. Unbelievable focus, to even the detriment sometimes of their own people. They work late hours, they don't get paid a lot, and yet that relentless sort of passion remains. And the third is how bold the center was. So we're talking about a nonprofit that, even though it's one of, if not the leading voice in adolescent health, even though they've been called by Congress to testify, we're still talking about a relatively small gem. And I say gem because when I saw not just the talent, not just the passion, not just the focus, but I also saw where they wanted to go, what they wanted to be. They're gonna go from a hidden gem, a kind of diamond in the haystack, to being a very visible force in a really exciting and emerging space. In other words, they're gonna go from being a really excellent place to deliver healthcare to a population that currently doesn't have access to that healthcare, towards being an organization that we're gonna point to and we're gonna say, that's the way that healthcare should be done in this country. The presidents are gonna point to and say, that's what we want for every American. It's 360, it's focused on the individual. It is very human in the way that they treat kids. That's what's gonna happen in the next 5 years. And it's really cool to be kind of at the start of that today and kind of peeking in a little bit.